Welcome to Health is Wealth. On Health is Wealth today we will be discussing breast cancer, a significant health concern globally, impacting millions of individuals and families every year. Stay with us today as we go deep into our study. Did you know that breast cancer affects 1 in 8 women globally? Breast cancer is a significant health concern globally, impacting it's one of the most common cancers among women, with statistics showing its prevalence across various age groups and geographical regions. Beyond its physical toll, breast cancer also carries substantial emotional and financial burdens for patients and their loved ones, underscoring the importance of awareness, early detection, and effective treatment strategies. Breast cancer develops when cells in the breast tissue begin to grow uncontrollably. This abnormal growth typically starts in the milk-producing ducts or the glands that produce milk globules. Over time, these abnormal cells may form a tumor, which can be benign, non-cancerous, or malignant cancerous. In the case of malignant tumors, cancerous cells can invade nearby tissue and spread to other parts of the body through the bloodstream or lymphatic system, a process known as metastasis. The exact cause of breast cancer is not fully understood, but factors such as genetic mutations, hormonal influences, environmental factors, and lifestyle choices can contribute to its development. Regular screening, early detection, and prompt treatment are essential for managing breast cancer effectively. Sure, let's discuss both modifiable and non-modifiable risk factors for various health conditions. Non-modifiable risk factors. As people age, their risk for certain health conditions increases. For example, the risk of heart disease, stroke, and certain types of cancer tends to rise with age, and also some health conditions have a genetic component, meaning individuals with a family history of a particular condition may be at higher risk. Examples include certain types of cancer, diabetes, and cardiovascular diseases. If at this point you are not subscribed to Health is Wealth, you probably are not going to see us again. If you are, congratulations, we will never let you down. Modifiable risk factors. These include factors such as diet, physical activity level, tobacco use, and alcohol consumption. By addressing modifiable risk factors through lifestyle changes and preventive measures, individuals can reduce their overall risk of developing various health conditions, even if they have non-modifiable risk factors like age or family history. Regular screenings and early detection play a crucial role in improving treatment outcomes for breast cancer. Here's why they are so important. Breast cancer is often treatable when detected early. Regular screenings, such as mammograms and clinical breast exams, can help detect cancer at an early stage when it's more likely to be localized and easier to treat. When breast cancer is detected early, there are more treatment options available. Early-stage breast cancer may be treated with less aggressive therapies, such as surgery or radiation, which can lead to better outcomes and fewer side effects. Studies have shown that women whose breast cancer is detected early have higher survival rates compared to those diagnosed at a later stage. Early detection allows for prompt initiation of treatment, which can improve the chances of survival. Early detection may enable less aggressive treatment options, sparing patients from more intensive therapies like chemotherapy or mastectomy. This can lead to a better quality of life during and after treatment. Knowing about cancer at an early stage provides an opportunity for healthcare providers to develop a personalized treatment plan tailored to the individual's needs, potentially resulting in a better long-term prognosis. For individuals at high risk of breast cancer due to family history or genetic factors, regular screenings may detect cancer at its earliest, most treatable stages or even identify precancerous conditions, allowing for preventive measures to be taken. So yes, regular screenings and early detection are essential for improving treatment outcomes, increasing survival rates, and reducing the overall burden of breast cancer. It's crucial for individuals to adhere to recommended screening guidelines and maintain open communication with their healthcare providers to ensure timely detection and intervention. Certainly, here's an explanation of the different screening methods available for detecting breast cancer. Mammography is the most common breast cancer screening method. It uses X-ray images to detect abnormalities indicating cancer. Mammograms are recommended for women starting at age 40 and should be done regularly, typically annually or as advised by a healthcare provider. Digital and 3D mammography are advanced techniques that provide better detection rates and fewer false positives than traditional film mammography. Secondly, we have clinical breast exams, also known as CBE, or physical examinations of the breasts performed by a healthcare provider. During a CBE, the provider will visually inspect and palpate, feel, the breasts and underarm areas to check for any abnormalities, such as lumps or changes in texture. CBEs are typically recommended as part of a woman's regular checkup, usually every 1 to 3 years for women in their 20s and 30s, and annually for women 40 and older, in conjunction with mammograms. Breast self-exams involve women examining their breasts regularly to become familiar with their normal appearance and detect any changes that may occur. They visually inspect and palpate their breasts to look for abnormalities. BSEs were once recommended for breast cancer screening, but current guidelines do not recommend routine BSEs due to effectiveness and anxiety concerns. However, some providers may still suggest BSEs for breast awareness. While breast cancer screening methods are helpful, they are not perfect. False results can happen with any method, and no test is completely accurate. Women should discuss their risk factors and screening options with their healthcare provider and get regular screenings for early detection and treatment of breast cancer. Sure, here's an overview of the various treatment modalities for breast cancer. Surgery is often the first-line treatment for breast cancer and involves removing the tumor and surrounding tissue. Lumpectomy. Removal of the tumor and a small margin of surrounding tissue, preserving the breast. Mastectomy. Removal of the entire breast, which may be necessary for larger tumors or certain cancer subtypes. Sentinel lymph node biopsy. Removal and examination of nearby lymph nodes to determine if cancer has spread. Axillary lymph node dissection. Removal of multiple lymph nodes in the underarm area if cancer has spread beyond the sentinel nodes. We also take a look at chemotherapy, which uses drugs to kill cancer cells or stop them from growing and dividing. It can be administered orally or intravenously and may be given before surgery, neoadjuvant, to shrink tumors, or after surgery, adjuvant, to destroy any remaining cancer cells. Chemotherapy may also be used to treat advanced or metastatic breast cancer to control the disease and relieve symptoms. Radiation therapy uses high-energy beams to destroy cancer cells and shrink tumors. It is typically administered after surgery to reduce the risk of cancer recurrence by targeting any remaining cancer cells in the breast or surrounding tissue. Radiation therapy may also be used to relieve symptoms and control the growth of metastatic breast cancer in other parts of the body. We also have a therapy known as targeted therapy, specifically targets cancer cells while minimizing damage to healthy cells. It works by interfering with specific molecules involved in cancer growth and progression. Hormone therapy, also known as endocrine therapy, is used to treat hormone receptor-positive breast cancer, which relies on hormones like estrogen or progesterone to grow. It works by blocking the effects of hormones or reducing their production in the body. These treatment modalities are often used in combination or sequentially as part of a comprehensive treatment plan tailored to each individual's specific type and stage of breast cancer. Breast cancer presents complex challenges but also opportunities for progress and hope. With personalized treatment approaches, advancements in research and technology, and holistic care, we are making strides in improving outcomes for patients. By fostering awareness, support, and collaboration, we can continue to push boundaries and empower individuals affected by breast cancer to lead fulfilling lives. Together, let's remain committed to the fight against breast cancer, striving for a future where it is no longer a threat to our health and well-being. The mission of Health is Wealth is to improve people's life and well-being. Don't forget to check out our other videos. Join us on our journey. Thank you.